Hi, I'm Dr. Suman Singh, Senior Obstetrician and Gynecologist at Manasi Clinic, BTM Layout, Bangalore. Ectopic pregnancy. I do not know how many of you know what this is. This is an abnormal pregnancy condition wherein the pregnancy gets stuck in the tube. So for you to understand what I'm talking about, okay, normally what happens is the egg gets released from the ovary and the sperm gets into the uterus and together they fertilize in the fallopian tube. Now, if the embryo, once it is fertilized in the fallopian tube, if it gets stuck in the fallopian tube and it continues to grow there, then it is called an ectopic pregnancy. So, a pregnancy which is growing outside the uterus, most commonly in the fallopian tube, is an abnormal pregnancy which needs to be diagnosed in time and treated before it leads to complications. Typically, a patient with ectopic pregnancy will have a history of missing a period. The pregnancy test will be positive. Sometimes they can have mild pains, they can have some spotting. But then, when we evaluate them on the ultrasounds, we find that the pregnancy is not growing very well. The chronological changes in the pregnancy that should happen with time is not happening. And in these situations, when we do a scanning, sometimes we do not find the pregnancy inside the uterus, we find a pregnancy outside the uterus. Why is it important to diagnose it in time? Is because we can treat it medically if we diagnose it early. If we diagnose it after a certain time when the pregnancy has grown, the pregnancy can even burrow through the fallopian tube, it can even rupture and cause massive bleeding inside the abdomen, causing a lot of life-threatening complications also for the lady. So, a ectopic pregnancy that is diagnosed in time can not only save the lady her tube, it can also be potentially life-saving.